Good evening, everyone. I'm not sure how many people are here yet, but welcome to Your Thirsty Pet. I'm Dr. Merrianne Burtch, and I'm going to be presenting tonight, basically talking about reasons that any pet would increase their thirst and sometimes subsequently their urination. And it's a pretty complex subject, so I have quite a few slides that I'm happy to slow down with and have you guys put a hand up and let me know if it's too much too fast. But hopefully you'll walk away with some really good ideas about assessing your pet and water consumption. We're here on behalf of BirchBark, and for any of you who are not familiar with BirchBark, we are an organization that is now 11 years old, and we have three primary missions. One is to provide economic support to low-income families whose pets have medical situations that they can't afford fixing, and the pet has a good prognosis. Two is to have grief support, and we've really expanded that in the last 2 years. We have 3 counselors that work with us for weekly meetings for grief support, and also on individual calls to help people who are going through the process of losing their pets before, during, and after the loss. All of that can be so emotionally trying when you're attached to pets. And then our third is what you're witnessing right now, the education webinars. So basically, celebrating the human-animal bond is the purpose of BirchBark Foundation, and we do that through maintaining it with our economic support, celebrating and honoring it through our grief support, and enhancing it by educating people to increase their knowledge of how to be advocates for their pet, because these creatures without the capacity to speak really benefit from our guidance and stewardship. And lectures like this is intended to maximize what you can do for your pet. So I think Rebecca has both the Q&A and the chat set up. So during the talk, you're welcome to put your questions in. I might try to answer most of them at the end to not lose some continuity for the talk. But please, questions are welcome, because the goal is to maximize everyone's information that they take away from the night. So just an overview of what we're going to do tonight. We're going to talk about water balance and kind of what drives thirst, and basically what happens in the body when there's not enough or too much water, and reasons for abnormal intake of water, and what kind of reasons for abnormal losses of water in the body. And then throughout, we'll have examples of diseases where those things are demonstrated. And then at the end, we'll have some questions and announcements for some activities that BirchBark has coming up. So thirsty pets, why a pet might drink more. So water regulation is determined by a variety of mechanisms. And one is how much sodium's in the body. And anyone who's had a big salty bowl of popcorn knows that you're very thirsty afterwards. And the body is reacting to that. Osmolality, or thickness of the blood. And I'm going to say, sorry, my beagle's howling in the background. Hopefully that's not ruining what you hear. So thickness of the blood and feedback from the kidney loop will kind of tell the body what to do. And there'll be some pictures on this next. And then drugs, there's a hormone called antidiuretic hormone that helps our water balance. And then water or blood losses. So if you lose blood or free water in your body, through the kidneys, the intestines, or anywhere, then that's going to make a change. And then hormonal influence, basically endocrine diseases and how the hormones can affect our thirst and our water output. So water is 70% of our bodies. And a normal body, and this is extrapolated from humans, uses 2.5 liters of water in a day. And we have a distribution of kind of where where the brain or where the parts of the body use water. But our bodies only make about 300 milliliters of water a day. And so we have to take the water in to make up the difference. For dogs and cats, an average of about 30 mils or 1 ounce per pound per day is what we expect them to drink. And of course, that's going to vary. Hot days, it's going to change. And also important things to remember is the type of food that they eat, whether they have a dry food or a moist food, can change the need for intake. If you have a bowl of soup for every meal, you're going to drink less water because you have water intake in your food. And we use that a lot to help hydration with dogs and cats adding water to their food. So how thirst works, and this is a kind of a busy slide, but I just want to kind of have a brief feedback loop that you can see. So if you don't have enough water in the body, it decreases the volume of your blood, and then your blood pressure goes down, and then hormones, this one called angiotensin, tells your body, hey, we need to do something about that, and stimulates you to drink water. So the thirst center is a part of our brain, and the hypothalamus makes us thirsty, and we drink some water. So the other is that when we decrease water in our body, the thickness of our blood changes, and there's actually receptors in our brain that says, wow, this blood's a little too thick, and we'll also get a dry mouth, similar stimulation, and driving us to get a drink of water. So this is a similar slide. And again, these are pretty busy, so I don't want you to try to understand it all, but just a quick look at if you have too much water, then you're gonna, and they're calling it disturbing homeostasis. You have less sodium, and then those osmoreceptors go, whoa, there's too much water in here. And through a hormone system, we pee more, and then or do something to get rid of the extra water, and we go back to homeostasis. And the opposite is when our blood gets too thick, we will actually make less pee and try to drink more, and then get back to that homeostatic system. So there's a lot of systems in place to try and make our water balance adjust to situations. And these are just some fun slides about, this is actually my cat and another veterinarian's dog here. So just a moment of looking at fun pictures. So water balance regulation. Sodium is pretty important. So too much sodium tells us when to drink water. Too little also tells us when to get rid of water. And then these osmoreceptors, which we've already discussed. And then hormones, which will regulate our ability to retain or get rid of water. And those hormones talk to other organs. So the kidneys, the hormones, and we'll find out later, other structures contribute. And then sugar levels. And that's specifically diabetes mellitus, which is one of the diseases we'll talk about. And then loss of blood is another reason why we would drink more. So if you were in a traumatic accident and lost blood, your body goes, whoa, that's not enough blood. Let's take in some water so that we can make more. And so also things like an ulcer in the intestines where blood is lost that way, the body responds by increasing intake to make up for the losses. And we'll have some examples of that as we go through the talk. And then the kidneys, which we'll talk about quite a bit, they will actually respond to less oxygen. So an animal that's anemic and is low on red cells deliver oxygen to our tissue. And when we have less delivered, the kidneys in particular notice that and will say, okay, let's make more red cells and let's get some more water on board so that the rivers sending my ships of oxygen carrying cells are flowing better and getting me more oxygen. So what are types of way that our body can have water loss? So normal losses would be, stool. So if you have diarrhea, you're going to lose more water than a normal stool. Peeing or urinating, panting, and in dogs in particular, they don't sweat. In us, we sweat quite a bit, but dogs will pant. And so dogs that are panting a lot actually will lose more water. And then abnormal losses, having loose stool and diarrhea, urinating more than usual, loss into your body cavities, and we talked briefly about that, vomiting, and inadequate intake, so dogs that can't get to water, and then blood loss. And then, as we talked about, sometimes the body says, I need more water or more blood. And it's not that there's an abnormal loss, it's that some system is disrupted. So heart disease is a good example. When the heart's not pumping normally, the kidneys go, wow, I don't have enough blood. Let's make some more blood. Let's drink more. And then what'll happen is that you'll retain too much water. So congestive heart failure is actually a misfire of that system where the body's trying to retain more water, and it thinks it needs more water because the heart's not pumping efficiently, and all the organs are saying there's not enough blood here, and then it can turn into congestive heart failure. Kidney disease, blood loss, and anemia are other triggers for fooling the body into saying you need more water, and those animals will drink more as a result. So one of the important things to look at, us as veterinarians, is to say, well, is this animal drinking more because they're peeing too much, or is this animal peeing more because it's drinking more? And that kind of helps us figure out which system is affected. And you can't really tell as the pet owner because you just see more water in and more pee go out. So we have to look into that and figure it out. So increased intake of water. If we look for a reason, some of the common reasons that are normal, if you will, or don't involve a disease process is a diet change. So if I change my dog from a dry kibble to a canned food, the amount of water that they drink is going to go down quite a bit because they're getting a lot more water in their diet. Weather change is important because if you have a very hot day and a dog is panting all day, or dogs that get excited and pant more, they're going to lose free water when they're panting, and they will actually need to drink more as a result. And I put diarrhea on here because sometimes dogs will have a single day of diarrhea flare. They'll go to the ocean and drink salt water. They'll get excited about something. They'll eat some rich treats, and they'll drink more water for that day or two. And that's a very different thing than, following weeks of excess water consumption. So things for people to pay attention to. If you're like, wow, my dog's drinking more water today, or my cat's drinking more water today, and you go to the litter box and see that there's very loose stools, then it's something that brings you to your attention and you can follow it. But if it's a transitory thing, they might just drink more for a day or two. Panting and exercising more will definitely make dogs drink more. Certain medications, so it's important for you to know, some dogs go on short courses of steroids for itchy skin or other reasons, and that can definitely increase water intake and urination output. And that works mostly by diluting the urine. So that's pees more, therefore has to drink more. And then vitamins and supplements. I had a very interesting case about, it's probably been 6 or 7 years ago, of this cute little older dog with a high calcium. And we were trying to figure out why. And we did all the tests to figure out why, because a high calcium will make you drink and pee more. And that's what the owners noticed. And after running a lot of tests looking for kind of bad disease and finding nothing, which was great in this 14-year-old dog, we realized that one of the multivitamins the owner was giving her had vitamin D in it and some calcium. And that was actually bringing her calcium above the normal level and creating this drinking and peeing pattern that we were able to resolve by just looking hard enough to find a source. And of course, we took her off that vitamin. And it's with all good intents that she was, getting the vitamin supplement. So if no reasons identified in this short observation of increased water intake, then you want to monitor your pet and think about testing if it persists. So an increased intake, here's some medical reasons that you would increase your water intake. Intestinal disease, so water losses in stool. Heart disease, and we touched on that a little bit. The body thinks it doesn't have enough blood when the heart's not pumping the blood well. Anemia or blood loss, so having not enough red cells to deliver your oxygen tells your body, hey, either there's not enough blood or there's not enough ships to send my oxygen around. And so that'll trigger the body to drink more. And we can have a dog who's not dehydrated, but if they're anemic, their body perceives that there's not enough blood and they'll drink more. So increased urine output. If you lose more fluid through your pee, then you're going to increase how much water you drink. And some of the reasons for increased urine output: kidney disease. Kidneys can't concentrate the urine well. We'll talk about that probably more than you want later. Endocrine disease, so those diseases we talked about briefly, diabetes is one of them. A high calcium can affect the kidneys and the concentration of the urine. And then infections, urinary bladder, kidney infections, and then other infectious diseases can certainly trigger changes in water balance. So our list of endocrine diseases for water balance disruption: diabetes mellitus, and many people know about that. And diabetes comes from Greek, and it means siphon or to pass through. And mellitus is actually Latin for sweet. And so that's the insulin glucose thing, and we'll talk a little bit about that later. And then diabetes insipidus. So in this case, it's basically a disease that doesn't allow the urine to concentrate. And so in people, I think they produce 1 to 3 gallons of urine in a day, and people with diabetes insipidus can produce up to 20 gallons of urine in a day. And what it does is this one is a primary polyuria. You're peeing too much, so you have to drink a lot to catch up with it. And that's where the disease is in diabetes insipidus. Hyperadrenocorticism, so that's also known as Cushing's disease. Many people have probably heard of that. And the body is making too much cortisol, which is one of the hormones, stress hormones, and it can cause the body to increase water intake and urine output. Interestingly, the opposite, hypoadrenocorticism or Addison's disease, can cause some excess drinking and peeing. In that disease, a lot of times electrolyte balances are off and there's not enough sodium. And so they get dehydrated very quickly because they can't retain that water. The sodium kind of holds the water in the body. Hyperthyroidism, which is a cat disease, and an overproduction of thyroid hormone can cause them to drink and pee a lot. They usually also lose weight and have a ravenous appetite. And then hyperparathyroidism. So the parathyroids are little glands that live next to the thyroid and regulate our calcium. And we'll have a slide on that down the road. So infectious reasons for drinking more: E. coli infections. And E. coli is probably one of the most common infections we see in the urinary tract. And it's also one of the medication, or one of the diseases that BirchBark treats quite often, is something called a pyometra. So people who haven't spayed their female dogs, the female uterus can get an infection because the canine body acts like it's pregnant, even if it's not. And so after a heat cycle, the uterus can be very susceptible to supporting an infection. And E. coli is one of the bacteria we see there. And people will often come in and say, my dog is drinking a ton. And that'll be a presentation sometimes for dogs with uterine infections, because the ability to concentrate urine is affected by the E. coli. It actually makes a toxin that can change the ability for the kidneys to concentrate or retain water. And then leptospirosis, which if you get our newsletter, you heard about last month. This is a disease that really comes around a lot more when there's rain in this area, and there's a little hotbed of it in Carmel. And leptospirosis is an infectious disease that causes change in the vessels, and there's tons of vessels in the kidneys, and so it can really alter the architecture and the health of the kidney and cause protein loss, and sometimes glucose will spill out of those kidneys even with normal blood sugar. So that will change the ability to concentrate urine, and a lot of dogs will be very heavy drinking and urinate a large amount when they have that disease. That disease has a bunch of stages, so it doesn't always show up as drinking and peeing a lot, but it is something to check for if you have a dog who is showing those signs. Cats actually don't get leptospirosis very much. It's very, very rare in cats. So other infectious reasons: diarrhea from viral or bacterial infection can cause excess loss of water. And this picture is actually just a bunch of inflammatory white blood cells. And then infection in body cavities. So you can actually have, kitties will do this, indoor outdoor kitties that fight can get an infection in their chest. And the infection is outside of their lungs, but inside of their chest wall. And so this X-ray here, this kind of blue lines you see, these are normal lungs, but outside of the lungs and inside of the ribs is some fluid, and that's an infection. So as the body is walling off that infection in this virtual space that's now filling up with pus, that's a lot of fluid that the body puts in there. And so it'll actually dehydrate animals, and those cats will sometimes be just found at the water bowl drinking because they're trying to make up for lost volume of blood or water because it's going into cavities of the body. And the same thing with the pyometra, those dogs with the uterus infection. Sometimes there's pounds of fluid in the uterus, and that's lost from the bloodstream. So abnormal losses, diarrhea and vomiting, the endocrine diseases, inability to change the concentration of the urine. So if you're unable to retain water when your kidneys filter your blood, then you're going to run low on water. And inability to replace body water stores. So access to water. So if you go backpacking and forget to bring enough water for your dog, that's a problem. And then nausea. Some dogs, without overtly vomiting, some dogs and cats, if they're nauseous, they'll just not want to take anything in. And so those are reasons for not being able to replace your normal body water stores. So the amazing kidneys, they are amazing. And Rebecca put this great background, which shows you how vascular they are. That's the blood vessel system in the kidneys. And they're really bossy organs. They're kind of, they kind of run the show in the body. And you think, there's a lot of obviously vital organs, but the kidneys they talk to everyone. So they're kind of our garbage service in our body. And when they talk, we listen. So kidneys filter blood to remove toxins, and 25% of each heartbeat volume of blood goes to the kidneys and does this filtering. And so they have this complex set of tubules that basically the blood is filtered, and then as it goes through, as that filtrate goes through the tubules, good stuff gets sucked back into the body. And so it's like, oh, I'll take the potassium back, and I'd like some more water and maybe some sodium, and oh, we're going to keep the sugar. So these tubules, they're called, have to have this gradient. I think of it as a sponge. And so if the sponge is all set up right, then you're going to pull all the good stuff back, and you're going to have a normal amount of pee. If the sponge is broken, then a lot of stuff will get through, and a bunch of pee will be made, and you'll lose some of the good stuff with it. So the concentration of the urine changes to help maintain the hydration and water. And one of those first slides where the feedback loop was, oh, pee more, we have too much water, or don't pee very much, we don't have enough water, is a very active system in the body. And so if the gradient's not well established in that sponge system, then it can affect the concentration as well. And so each time the heart beats, the kidneys are like, thanks, got enough, thanks, got enough. And sometimes if the heart's not working, the kidneys will be like, that's not enough blood, I need more. And that's part of the system for congestive heart failure, because the kidneys say, we need more water, drink more, we need more water, don't pee as much. And that's not necessarily the truth. What it is that the heart pump is not pumping well. So the body retains water when it shouldn't. And that's part of why we use diuretics in heart failure. And a hormone system, which could get really complex, renin's one of them, tells the body, take in more fluid. And also they tighten the blood vessels so that the pressure is greater, and that'll compensate sometimes for a heart that's not working well. So we talked about urine concentration quite a bit, and the concentration of urine is determined by the amount of solutes, how much stuff, good stuff or bad stuff, got put in there. So when we think about water having a concentration of 1.000, a normal dog is going to have a urine concentration. It's a pretty wide range from 1.015 to 1.050. And because we're lazy, we call it 1015, 1020 when we talk in veterinary terms. Now, cats tend to have a more concentrated urine, so they're normally going to be in this 1.025 to 1.065, and sometimes even higher. And those of you with kitties out there that are familiar with crystals in the urine of cats, that's part of why we run into that problem, because cats sometimes don't drink enough water. And sometimes our therapy is trying to get them to drink more water so that they don't form those crystals and create problems in their urinary system. And so an animal in kidney failure is going to have a lower concentration because that sponge is not working and the filter unit is not as effective as keeping water in. And then diabetes insipidus, which we'll talk about a little bit later, you just can't concentrate the urine. The kidneys just are lacking the capacity to do that. So their urine in those patients are close to water. So kidney disease, there's basically a gradual decrease in the ability to concentrate the urine with age in some pets. So healthy kidneys, and I use this example to help people understand why kidney disease can be present even though animals are drinking and urinating a lot. So in a normal kidney, and I'm kind of making these numbers up, but let's say you can take out a day's worth of toxins in a half a cup of pee in a day. Well, when the kidney can't take those toxins out effectively, then suddenly you need 2 cups of pee to remove the same amount of toxins that you used to be able to take out with a half a cup of pee. And so these animals have to drink more because it takes more pee to get rid of all the toxins. And so more urine's produced and more water has to be consumed to make up for that loss. So again, we go back to, are you peeing too much so you drink more, or are you drinking too much so you pee more? And in this case of kidney failure, it's usually that you're peeing more, so you have to drink more to make up for it. Okay, that moves us to calcium. And calcium is pretty essential in our body. It's amazing how much it is a subcellular, intracellular communicator, and it helps with all kinds of information across cell walls. So our body regulates it pretty well. And also because it's part of the bone system, calcium and phosphorus are watched really closely by our endocrine system. So high calcium makes a pet drink more by affecting the hormone that concentrates urine, the antidiuretic hormone. And so we normally manage our calcium with a hormone called parathyroid hormone. And I have the next slide will detail that probably more than you'd like. And so certain hormonal diseases and kidney disease can affect the metabolism of calcium. And some of the hormonal diseases, we'll see that with Cushing's and Addison's, they'll change how much calcium there is. Cushing's actually decreases calcium. Addison's will bring it up. And sometimes we find that disease because the calcium's high. And then parathyroid disease as well. Now, there's also certain cancers that can affect calcium. So the parathyroid is a hormone that regulates our calcium, and the next slide will explain that. But certain cancers can actually make a mimic hormone called parathyroid related peptide, or PTRP. And what they do is they tell the body, hey, we need more calcium. And they drive the calcium up in the blood system, and then they act like a dog with a high they get a high calcium, and so they drink and pee a lot. And sometimes that's the first sign that owners will notice, and then we'll look for these cancers if we don't find another reason for excess water consumption. So mammary cancer, anal gland cancers, it's called an apocrine gland anal sac carcinoma, and lymphoma and multiple myeloma. And those are what we call round cells. So all of those types of cancers and some others will make this synthetic or fake form of the parathyroid and convince the body it needs more calcium. So this is a pretty busy slide, and it's probably best if you read it later, but a quick cover. I don't feel like you have to understand anything. I don't want anyone to have PTSD from high school biology either. So these parathyroid glands live here. What happens if it just makes sure that the calcium stays in one area. And if the calcium levels get too high, then it'll actually decrease how much calcium comes out of is taken up by the kidneys. It puts the calcium back in the bones. And so it won't let you keep as much calcium in the body. So when we have a low calcium, the parathyroid says, hey, we need some calcium. Don't put so much out the kidneys. And can you get some from the bones? And hey, let's take more up from the guts, and then tries to balance it. And so in this cancer system, it'll actually it'll act like this parathyroid and make the calcium go up. And veterinarians look for that. And the calcium is hard to measure. And we use different blood tests, ionized calcium and regular calcium. And it's pretty easy to measure these things as well to help look for these diseases. So now we move on to our diabetes. So we have the two types of diabetes that we talked about in the beginning: diabetes mellitus, which is the one is related to glucose. So excess blood sugar results in because there's not enough insulin, which is made by the pancreas. And insulin's job is to move glucose from the blood into the cell. So there's plenty of sugar in the blood, plenty of glucose, but it can't get into the cell. So that's where all the energy is made, inside a cell. And so the body feels like it's starving. So normal blood sugar is 80 to 120, and diabetic pets have sugars in the 250 to 700 range. And this starvation state happens. So if it's not addressed, the body will go into a negative energy balance and make something called ketones, which can really make dogs feel worse. And what happens is our kidneys don't let glucose go into the pee until about a glucose level of 200. So over 200, glucose goes through that sponge we talked about, the filter unit in the kidneys, and the glucose actually pulls more water with it. It's an osmotic pull. And so these dogs are peeing too much because they're pulling more urine. They're making more urine from pulling more water through their kidneys. And then secondarily, they're drinking a lot to try and compensate for all that water loss. So that's how diabetes makes animals drink and pee more. Pee more first, drink more as a sequelae. And that's also true for diabetes insipidus, because this hormone that tells the kidneys how much to concentrate the urine is missing. And it's missing either because the brain is not making it, or because the receptors on the kidneys are broken. And so there's kind of two types of that. And I have cartoons for those who are much more visual. I know it helps me all the time to kind of explain this. So in diabetes mellitus, and I don't know why the pancreas looks like Cyrano de Bergerac's nose, but here it is. So a healthy pancreas is going to make insulin, let the glucose go into the cell through this receptor. We all talk here about type 1 and type 2 diabetes. So dogs are almost always a type 1 diabetes. That means they don't make their own insulin. Their pancreatic cells that make insulin are usually destroyed. And so the glucose is hanging out here in the cell, and it can't get inside because there's no insulin to hit this receptor. Now in type 2 diabetes, which is more common in people and interestingly cats, close to 70 or 80% of cats have type 2 diabetes. In those cases, there's insulin around. Some is being made, but it's pretty ineffective. And part of it is that in people, it's documented that the pancreas just kind of goes, I'm done. I can't keep up if you're taking in too many carbohydrates. And so it actually affects the effectiveness of the pancreas. And so the cells don't get the glucose because it can't get in because there's not enough insulin, and the receptor is damaged by the disease. The pancreas too, but that's way too much information. Basically, cats type 2, dogs type 1, and this is how diabetes works. Now, diabetes insipidus, in a normal person, if we make this much urine because the pituitary gland is telling our kidneys, don't lose too much water, we need to retain some. But in diabetes insipidus, where it's central, the kidneys don't get that message, and then all this pee comes out, and the body has to make up for it by drinking a lot more water. Again, our urine concentration slide, this diabetes insipidus, this is almost the concentration of water. So there's a lot of work to catch up with that. Now, there is a synthetic form of this antidiuretic hormone that you can give to dogs. So our central diabetes insipidus dogs, there is a treatment for them. It's pretty rare in cats. So other endocrine diseases for us to put on the list, Cushing's disease or hyperadrenocorticism. It's like having a pet on prednisone all the time. For those of you who've had dogs and cats on prednisone, dogs much more than cats, they'll drink more and pee more. And then other characteristics you'll see in this disease is eating a lot, peeing a lot, hair coat changes. They usually have a decrease health of their coat, a pot belly appearance because the extra cortisol will relax the abdominal muscles. So, and those dogs can have other things, high blood pressure, protein in their urine, and usually veterinarians are pretty good finding that disease. Hypoadrenocorticism, so not enough cortisol, or in this case, mineral corticoids. We call this disease the great pretender because it can look like kidney disease, it can look like intestinal disease, can look like a lot of different things. I'm getting visited by my Zoom bombing cat, but if you see shadows in the corner. And so there's a lot of different things that we look for when we think there's Addison's disease. Calcium levels change, they get anemic, their intestinal health can change. So again, that might be if you hear an emergency doctor talk about arresting cortisol, that's looking for Addison's disease. Hyperthyroidism, those of you who are kitty people know that cats make a non-cancerous, we call it an adenoma, so hypertrophy of the thyroid gland over time, oversecrete thyroid, and it causes weight loss, increased thirst, and other issues for cats. They usually are hungry and have weight loss. And then acromegaly, pretty rare, but does happen. Cats actually get it. And those of you who are a fan of The Princess Bride may remember one of the characters in there, Andre the Giant. He was an acromegalic person. And so it's a good example of what can happen. It's excess growth hormone. And so the body makes too much. It's a pituitary misfire. And we see it mostly in cats. Most of them end up being diabetic because it antagonizes their insulin to have more growth hormone. And those cats actually also grow. Their kidneys get bigger, their heads get bigger, they will get heart disease. And you can actually treat it. Some people will do surgery to remove the damaged part of the brain that's oversecreting it. So outliers, because we covered a lot of different things, and hopefully it's not too overwhelming, but our outliers are adrenal tumors. So the adrenal glands are little glands that live near the kidneys, adrenal, and they can decide to go rogue and oversecrete certain hormones. So aldosterone is one of them. That happens more in cats, and there's some characteristic changes for those cats. A lot of times there's a tumor that you can surgically remove to fix the problem. There's epinephrine secreting tumors on the adrenal glands. Those are a little bit tough to diagnose, and finding them early is helpful. And then cortisol secreting tumors, which is a type of Cushing's disease. And then important to know is there's something called psychogenic polydipsia. And my first dog that I had during vet school actually developed this. And this is a little bit of a compulsive behavioral change. So dogs and cats can compulsively drink, much more dogs than cats. And when they do this, the owners are usually like, wow, you're drinking so much. And it can be just a little bit of an OCD thing more than an actual medical problem. And we can actually figure that out by, you have to do this carefully, because if there's a medical reason for them not having, drinking a lot and peeing a lot, then that doesn't work, as you don't want to take away their water because you could put them at risk for dehydration. But this water deprivation test is something you can do very carefully, taking away water and seeing if their urine will concentrate over time. You can also give them a hormone and see if they can concentrate urine. So some days pets just like to drink more water. So definitely watching for trends is important. So if my pet starts drinking more, first thing is evaluate the environment for a change, diet, weather, exercise, or stool. Monitor for a transitory change, and definitely you can measure water intake. So you can roughly say, oh, if my dog weighs 10 pounds, it should drink about 300 mils or cup and a quarter of water a day. And so that's something you just kind of sit down and say, an ounce per pound would kind of help you say, oh, that's 10 ounces of water in a day. And if your pet is drinking double that, then I would definitely say, okay, it's time to look into what's going on here. Evaluate urination patterns, how long they're peeing for, and whether they are squatting to pee and not peeing, because that's an indication of an infection for sure. And then watch for other signs of illness. So behavior, energy, appetite changes, and then check in with your veterinarian for testing if any of those concerns come up. So before we go to questions, I absolutely loved this video, and I thought it would be really fun for us to finish with. It is slow motion of how dogs drink, because most of us don't think or realize that they scoop from the bottom when they bring the water into their mouth. So that was something that I really enjoyed sharing. So let me get back. And here's what I wanted to share about events for BirchBark. So we are excited about launching our first ever peer-to-peer fundraiser, which is running through the month of May, which is National Pet Month. It's an opportunity for everyone, no matter their financial resources, to spread awareness about BirchBark and have a huge impact on our organization and our ability to provide important services to the community. So joining a team's easy. It's completely free. There's no minimum amount you need to give or raise. We're really just hoping to have as many people as possible participate because many hands make light work. And you can register using the QR code here. You'll be able to raise funds for BirchBark and earn fundraising prizes. And then we have a Paint Your Pet coming up. So on June 1st at the Painted Cork, you can paint a portrait of your pet. You actually send in a picture and they give you a framed kind of Andy Warhol style portrait that you get to paint in. And I actually have one. I did this when we did it back in 2020, and I love the picture, even though you can tell I'm not an artist. So it's kind of fun to do. So it's in Santa Cruz. Tickets are $75 and include everything you need to create the portrait, plus snacks, wine, and raffle prizes. You don't need talent, I'm proof of that, or experience, and you'll be walked through it. She's really great about walking you through ideas, and she supports you the whole time that you're there. And space is limited, so register early if you want to be part of that. Well, I hope there's some questions. I'll leave that up, and let's see what we have. No open questions. So looks like there's about 10 of you out there. Hopefully I didn't overwhelm you. And please feel free to type some questions in the question area or in the chat, and I'll do my best to answer them.
It looks like Annette has raised her hand.
Oh, okay.
I'm gonna click the allow to talk.
Okay, great. Hi, Annette, you're muted right now.
Okay, I think I'm off now.
Yeah.
Okay, I just wanted to say I don't have a question, but I found it very informative and appreciate the additional concise, all of the information in one place like that. Very well done. Thank you.
Oh, thank you. And hopefully you got a chance to see my cat Zoom bomb the
Yes, I did. He's a big boy.
She's 17, and for some reason Zoom is her favorite thing. And so
Really?
yeah,
How cute.
it is pretty cute.
Yes.
Good to hear your voice, and thank you for the feedback.
Yes, very well done. Appreciate it much.
Thanks. All right, it looks like we have a question. Oh, hi, Paula. So what does the painting indicate? My dog, oh, panting. Sorry, I was looking at the painted cork there. What does the panting indicate? My dog pants routinely and drinks a lot of water. Okay, that's a good question. So one of the things you want to look at is the timing on that. So if your dog is excited, or it's a hot day, or they've just gotten back from a walk, or you've just gotten home, then panting makes sense. And it's an excitement activity for dogs. Nervousness is also another thing. And in older dogs where I'm worried about pain, panting can be a manifestation of pain. So dogs that it's like I'm not sure what to do with these feelings I have, and they'll pant. And if I remember right from seeing you at the Peace of Mind event, your dog is pretty young. So but if I'm wrong, feel free to type in. So I usually with young dogs, I follow the pattern. And if the drinking a lot of water continues, or you feel like you measure, okay, he is about 9, thanks. All right, so he's not too young. So one of the things I'd start with is try to quantitate the water. And I think he's your only pet. So you'd say, okay, let's say he weighs, I think you've got a little dog, if I remember right. So let's say he weighs 30 pounds. Then you can say, oh, probably that's 30 ounces in a 24-hour period that he should drink. And so what you might want to do is measure out, that, okay, that's great. I can do the math for you. So 25 ounces is going to be close to a little more than 3 cups of water. So what you can do is measure out that much water in the morning and fill their water bowl. And in 24 hours say, okay, is that all gone? Or did he finish it in 12 hours? And so you can start to quantitate, is he drinking more water than a dog should drink? And if so, if you measure that and he drinks it all, you measure that water, say at 8 in the morning, and at 8 at night, his bowl is empty, then I'd say probably get him checked out. And you could start with just getting a urine test, but you may want to make sure there's not a medical reason for drinking a lot. And then follow that panting to see if it's associated with any anxiety or exercise. So hopefully that answers your question. Let me know if you have more questions along that, Paula. And I have a question from Darlene. My cat has several sources of water and spends time going from one to the other before picking one. Any ideas why? Also, she has trouble finding the top of the water surface. So that's so cats are kind of funny, and certainly they can be very particular about where they drink from. So one of the reasons those water fountains for cats exists is that cats sometimes really want moving water. And in some of the slide pictures, you saw cats drinking from the faucet, or some cats will wait for you to fill a coffee cup for them next to the sink. So there's a little bit of a social issue there. And so that may be part of what your cat's doing, is like looking for the preferred place to drink from. And people will also sometimes say, my cat wants to go outside and drink from the koi pond. And so drinking from outside sources will be something cats will do. So you may want to try a fountain, or try a particular, like if the water sources are all plastic or all metal, maybe try ceramic. And also it's not uncommon, I think, for cats, their whiskers are, sensitizers. And so sometimes their whiskers have to go in before their mouth hits the water. And you may see that some cats will actually even scoop across the water to kind of get it to move so they can see where the surface is in the reflection. So I don't think it's that uncommon for them to kind of look sloppy when they hit the water. And I would worry a little if your cat spends a lot of time at the water bowl, like they're ineffectively drinking, then that would be something where I'd say, ooh, let's make sure there's not something happening in their mouth or with their tongue. But what you're describing is not that uncommon for cats. They're persnickety about water sometimes. So I wouldn't consider that a danger thing. I think it's a little bit just a cat thing, but you may want to play with what you put the water in and see if she has a preference, like she always goes to the ceramic bowl or the metal bowl, or if you want to turn the faucet on, if you want to encourage that behavior, or get a little fountain. So that's what I would consider there. And then, I have somebody asking, how you determine what excessive drinking is when on your steroids or other drugs that you expect to cause increased drinking? That's a very good question. So, if your dog is put on steroids for medical reasons, then you will see an increased drinking and peeing. And one of it's dose dependent. So like the dogs that get put on, and cats sometimes too, they'll use a decreasing dose of steroids where it's a high dose for a couple of days and dropping down because we're trying to knock out an inflammatory process. You'll see that drinking being related to the dose. So if you have a dog that's on steroids and the vet can help you say, oh, is that a high dose or medium dose or a low dose of steroids? That should determine how much they're drinking. So if those dogs can sometimes drink up to 2 times their required amount. So if you have a dog, let's use Paula's dog, where we say 25 ounces a day, and suddenly that dog is drinking 50 to 100 ounces a day, then you might want to say, okay, is there something besides just the impact of the medication? And I think that's important because animals on chronic steroids can get urinary tract infections with a little more frequency. And so you want to differentiate that from, oh, is the medicine making them drink more? And another good example is diuretics. So animals with heart disease get put on a diuretic and people say, oh, they're drinking and peeing a lot. And sometimes we'll say, oh, yeah, that's because of the diuretics. But it is important to say, wait, if it changed, is there a urinary tract infection or some other underlying problem that we need to address? And so the next question is, can insufficient drinking be indicative of a pathological issue? And the answer is yes. And the question goes on to say, if that animal has to be coaxed to drink, is it that there's a problem or that they just have amazing kidneys? And there are actual animals. I have one patient who's a very otherwise pretty healthy 2-year-old dog. He just doesn't like to drink water. And so but he loves to eat. So what we ended up doing is calculating his water requirements and adding it to his food. And interestingly, I was checking that dog. He has some liver issues and his urine, and mom puts most of his water in his morning meal. And she brought him in and I wanted to check his urine, and his urine was super dilute. So I went, uh-oh. And I realized that, oh, I'm adding a lot of water. So she caught some pee from him before he had his water in the morning, and he had a very normal urine. So I could actually document that he was fine with his kidneys, that we were actually diluting his urine with the water we were putting in the food. So I would worry if you take how much water that, sorry, the dogs are getting rowdy behind me. If you take how much water that animal should drink and you say, okay, they're drinking less than half of that, then you may want to look at, is there underlying nausea? Is there a problem with the mouth? Is there swallowing issues? So that is a question that's worth looking into. So, okay, thanks for those questions. I think that was, Rebecca was adding that information. So those were all great questions, everyone. Thank you for adding that. And I think we'll wrap up unless anyone has any other questions. And we will get this posted on the BirchBark YouTube channel. For those of you that don't know, these webinars are posted there, and they include the ones from last year. There's an excellent one by Dr. Julie Smith about pet insurance. There's an excellent one by Dr. Lissa Richard about first aid in your pet. And I am definitely going to be working more on kitty stuff for you cat lovers out there. I'm trying to work on a behavioralist to talk about cat enrichment and some other things. So we'll keep you posted on the ideas, and we always welcome feedback and ideas for future webinars. So thank you very much for all of your support, and think about these 2 events here that are on the screen, and all of your support is saving pets and enhancing the human-animal bond. So thank you, everyone, for attending.